I'm going to talk today a little bit about having purpose in PPIE work and how this helps us to avoid tokenism, I guess, in doing PPIE. And I guess what I mean by that is having purpose in how we do participation and involvement. It can look like knowing what good involvement isn't, so what to avoid, asking the right questions of ourselves about what we're intending to do, why are we doing this, having really clear objectives and hopefully co-developing those with people and being prepared for partnership working. So not kind of charging in, making sure we've got the kind of resources and the motivation behind it. So yeah, so just to kind of have a bit of background, then public involvement and engagement. It's hardly a new agenda in health research, as we've been hearing about, but in practice, it can sometimes take the shape of outreach or engagement activity, which is fine. But if that's what you're calling involvement, not quite, because it treats people more like the beneficiaries of research or something where maybe we're the representatives of an all-knowing institution who's in the position of an educator. Indeed, even when we're invited to enter decision-making spaces, sometimes there can be unequal power dynamics between researchers and people with lived experience or members of the public, which can give rise to tokenism in priority setting, or I guess what you call like the presence of people without a voice or having voice without influence then. So you've been listened to, but you're not necessarily having your voice acted on. So you can see obviously the comparisons there between tokenistic participation, you could call it, and then purposeful participation, where you're not doing two or four people, you're doing something with them. There's shared responsibility, and we see it as something that's necessary, not like a nice to have, a tick box exercise. So to avoid tokenism, we need to be purposeful in how we work with people to ensure authentic, mutually beneficial, and long-lasting relationships. Some people might have seen before a ladder of involvement or a ladder of participation, something developed by somebody called Sherry Arnstein in 1969. It shows kind of you building up from that kind of engagement or outreach stuff all the way to co-production. But something that the Co-Production Network of Wales, who I'm very fond of, have done is just flip it on its side and show it as more of a spectrum. It shows kind of the difference then of doing those things, two or four people moving through to different levels of involvement all the way to co-production, where you can see it's you're working to co-design, co-deliver, co-evaluate your work with the people that your research affects. Flipping it on its side is quite a good thing, I think, because I think the ladder always suggested you had to be working upwards for everything. And while co-production and involvement is sort of the highest level of working with people you can do, all the stuff we can see on screen isn't necessarily bad in itself. Doing outreach, like Claire was talking about, is important to actually disseminate your findings, do outreach to share, to disseminate, to educate, to inform people. But if you're talking about involving people in your work, then it should be towards the end. So actually, I think if I click, I might have, there we go. So you can see actually where really kind of across here, I'd say engagement kind of feels a bit more like where you're consulting people, you're informing them, and involving people then is where they're having a chance to influence the work and or even to co-produce with you. And sometimes you need to do some of the latter. You need to actually sometimes educate people a bit or give them resources, give them capacity or knowledge in order for them to be able to move across and do involvement with you. So yeah, that's kind of what I'm trying to say here, is that it's not that one thing's bad. We just have to recognize that they're different from one another. And in terms of recognizing then definitions, which are important, what we mean by public partnerships and public partners, you can see the quote on screen, which is from the NIHR. I always struggle with that acronym. It's a way of just collectively describing the people we'd like to work with. So it's important because you have to kind of be able to define what we mean by a partnership. And the people who might be public partners could include patients or potential patients, could be service users, people with lived experience of an issue or a circumstance, could be paid carers, parents, guardians, people who use or have used a service, people with disabilities. And I like the way of describing them as partners because it kind of comes back to what I'm saying, where it's a statement of intent of how you're going to work. It's not just saying they are a stakeholder or a community. You're not keeping them at arm's length. They're somebody who you want to work with in equal partnership. So how do we do partnership working? What should our objectives be, which is a really important part of what we do. Research objectives can sometimes be a bit too static, or they could be quite lofty if they're straight from your application. Sometimes defining a destination in a way that leaves very little room for people to shape the journey with you. This can make potential partners feel like they don't have a meaningful role to play in research, and funders are increasingly asking researchers to demonstrate how partners have been involved in shaping our objectives prior to any application in particular. So purposeful questions are quite a useful way of framing what we want to achieve and who we need to work with to get there. It's something I picked up from a group called the New Citizenship Project 100 years ago when I was working in the National Trust, but I think it's relevant to any kind of public partnership working. So what is a purposeful question? It's something simple but powerful. So it's got three component parts. How can we? It's positive and open, implying that the question does exist and that there are different answers possible. Achieve X, so as in the direct impact you're seeking to affect, expressed in as inclusive language as possible. And then by working with the Y, demonstrating the necessity of going beyond your project team and the staff to harness the knowledge and the experience of other people who we need to work with. So some things that maybe make a good purposeful question might be that it's specific, not generic. So you're not being too vague, that it's strategic, not superficial. So that it'll give people an active stake in what you're doing, and that it's sustained, not one-off. So it's not just for maybe one bit of a project, it's something where you're trying to develop a long-lasting relationship, get people involved in shaping future research as well. So there are an example here that I wanted to give, which isn't from a research area, but it's a large organisation, Bank of England. They adopted this approach, and given they were driven by the belief that they would only be able to make the right policy decisions if there was more input from the public and citizens. I like the phrase, the word citizen as well. It shows it's a more active thing rather than a passive service user. Staff are encouraged to think aloud on a public bank underground blog where they could suggest new ideas. Every report the Bank of England does now has a summary in plain English for public understanding. And there's a set of regional deliberative assemblies which were established by them to discuss and inform policy directly, and they're still going today. So just shows how kind of holding a question can really frame what you do, and it's something to kind of circle back around to and say, are we answering this question, what we're doing? Another way of thinking about working is how we do kind of like a theory of change. You often see these on research applications. Sometimes as institutions, we can come across as quite transactional or tokenistic in how we present what we do. We're not like that in our mindset. We all say that we're for our communities, we all have the right intentions, but sometimes an element of that can creep in, or it can happen just by the structures that we're part of. So being really clear about what we're trying not to do is just as powerful a starting point as those purposeful questions. So a transactional theory of change, like you can see on screen, often looks like this, focused largely on PPR activities as a tick box exercise, achieving organizational goals. This is why having a shared and empowering plan, in this case of theory of change, is so important. So I think I've got an example here of where you can use your purposeful question to kind of frame what you're doing. So a good theory of change could be intended to help you hold meaningful goals in a way that can actually inform activities and efforts. When I do these, I always like to kind of work backwards and start with the impact. So what is the really big picture that your work is all about, from curing a disease to addressing inequality? So what are you trying to change? That can be something massive, because then your outcome is what's your contribution that your work is going to make towards that ultimate impact. So it's not going to solve it, but what can you do to help? And then in order to find that outcome, what are the outputs you need? What do people need to think, feel, know, and do? So this is in the context of involvement and engagement. Asking those four questions there is actually really powerful, because it makes you think, okay, well, what sort of knowledge do people need? How do they need to feel to actually be involved? Are they going to be switched off by what you're doing? And in order for them to feel those things, what do you need to do then? And so that's kind of the last thing you do. What are the activities that you need to do? So that when you're suggesting things, if it comes across as a bit bland or beige, you think, okay, maybe we need to up this because we need people to have these responses. So again, it's just a good way of framing your work, of considering how you're going to work with people. And I like that you can kind of frame it around your purposeful question if you've developed one. So just to think a bit then about who we're going to work with. Too often you can see, not just in research, but in past jobs I've worked in public sector as well, people will talk about having engaged with the community on a specific subject. And of course, you immediately think, well, what community? Who is that? Who are the people you've spoken to? Because that's really important. So you don't want to be vague. People can be part of multiple communities in different circumstances, in different contexts. On screen now, I think I've got just some communities that you can have, but it's an interesting way to kind of think about it. So you can have communities of interest, so maybe people who are sharing a common passion or a social identity, so it could be cultural groups, it could be something that people are all keen on. You can have community of practice, So people who share a common craft, a possession, or a discipline might be to do with education as well. You can have communities of place, which is often the easiest to think about, defined by a shared geography, a particular culture, region, or a city. You can also have communities of action who rally together to make a change on a particular difference. To make a change on a difference or particular issue. Lastly, you can have communities of circumstance, so people who maybe have a shared lived experience of something, a common situation, challenge, or life experience. So these are just some ways of thinking about the nuances of communities and how it can be helpful when you're planning partnerships. And I think together these kind of cover sort of the main asks that you have when people are talking about public involvement engagement, where you're either looking for that kind of lay or the public or the citizen perspective on something, so not a researcher's point of view, or it's the patient or community or the service user perspective of a particular thing. So while I have just said all those things, and they might sound useful, it's really important to remember all human beings are unique and characterized by a multitude of factors. It's really important if you're working with individuals to see them as individuals. They might come from a particular group, but you should never treat them as the representative of that group because there are so many different factors and things which shape our experience and our outlook. I prefer to kind of, especially if you're working with, say, like PPI members, and there's maybe one or two people who have got a condition or they're from a particular group, to treat them and talk to them as advocates for that group, not as representatives. It's a small language change, but it can actually free, when I've spoken to people about it, they sort of say, oh, that frees me up a bit more. I can speak just as myself, not feeling like they have to be a spokesperson. I guess another way of thinking about it, since we're talking about sale, is you wouldn't use a very small amount of data to draw a big conclusion. So don't do the same thing when undertaking PPI work. So we've talked a bit about communities, and then how do we find them? How do we map them? When you're thinking about this, what are some of the contextual influences on the project or on the people that maybe you're seeking to reach? These could be political, environmental, social, technological, economic, but they might not all be appropriate for your project, but they can change how your project progresses. So, or how they can change sort of people you might need to seek as your project progresses. It can be worth thinking about the strengths, weaknesses, opportunities, and threats presented by each factor when you think about who to work with. And then in terms of who maybe your stakeholders are, the people that you might want to seek, your core audience should typically be centered around the people who are affected the most. So that should be the people with lived experience of your research or who might be affected by any changes to policy. So that's people with lived experience. Maybe your internal stakeholders might look a bit like your project team. It could be practitioners, so people in the quote unquote real world who might be doing the changes. So it could be people in the health service or social workers or organizations. Could be other universities. Your other internal stakeholders might be the funding body, or it's useful to think about. And then your external stakeholders then should be like the general public, the broader public. Could be the media then, local governments, regulatory bodies, anything then that might be just associated with it. So again, just a useful way to kind of map who your stakeholders might be. Sometimes people say, well, I know kind of who I need to speak to, but I don't know particular names of groups. Do you know anybody? It's not rocket science for me, but like I'm just giving an example of something I did when I first started this job that I'm in now. I looked at the sale data sets and I literally just did a ton of Googling. So you can see, I think the example I've got here is looked after children. You can see all the data sets that exist within sale. And I just did a bunch of Googling for charities, groups, organizations that don't just represent the interests or the wishes of people who might belong to that group, but a lot of these groups on the right hand side there actually have their own consultative groups. So in the same way that Sale, we've got the consumer panel. A lot of these other groups you can see have got their own advisory groups. So they might have working groups with people who have got lived experience. So you don't always have to reinvent the wheel and sort of create your own group. Sometimes you can tap into other conversations which are happening. So yeah, just an example, but Googling gets you a long way. So nearly finished, but the last bit I wanted to talk about was just about some of the preparation that you need to think about before actually making contact and reaching out to groups. So in terms of like, are they the experts around the issue? Do some research online about the organizations you want to reach out to. Some might be more concerned with your issue, your particular niche issue, if you're doing something that's a bit more specific than others. So try and make it relevant to the people you're wanting to work with. Do you feel comfortable talking about the issue? The media and the community will pay attention to your project, hopefully. So you and your team need to be prepared to talk knowledgeably and proudly about the project and why it's appropriate and meaningful for you to be leading it. Depending on the research, this can be really, really important. If it's people from a vulnerable group, they need to feel like you're authentic, that you actually understand the issues and you want to help. So it can go a long way with trust. Similarly, are your colleagues on board? So it's very easy to kind of also be pigeonholed as the person who's going to do the engagement. And actually, if you've got people who you're working with, other colleagues, they also need to understand the importance of this work and know that PPI isn't just for you and them, it's for the whole team. So yeah, everyone should be able to feel confident speaking to members of the public or people you want to work with. What are your timeframes? This is something Claire touched on, but the earlier the better. Give ample time and intention to relationship building, especially when working with an impacted community who might face daily challenges or have concerns about trust. If there are any key dates or upcoming legislation or campaigns which might be related to the issue, that's good to consider. But it's never too soon to start speaking, even if you're not entirely sure what your research is going to look like yet. Actually, have that conversation and allow people to work with you to shape that. Have a think about the resources that you've got. I think the going rate that NIHR recommends for example, like an hour's workshop with PPI members is £25 an hour. That can be taken in the form of vouchers, but there are other ways of compensating people and making sure that they're feeling involved and appreciated. So that can be rewards and recognition. It could be being co-accredited in the reports that you do. It could be learning new skills. But yeah, making sure that you've budgeted for PPI is really important if you can. And there are some funds which exist to actually help people do that early engagement while you haven't got a bid created yet, which I know is an issue for people. How can you be reciprocal? It's that kind of mutual benefits thing. So that's kind of what I was just talking about in the last one, to be fair, but it's a way of moving from asking what you want from your potential partners, but actually what you can do for them. So it's not just about potentially financially compensating people, but are there new skills? Is it about helping create a new community, a community of interest, or a community of action that we were talking about earlier? So yeah, just some things to consider. I think I'm nearly out of time, but I've got our last slide. So just to summarize some key points. The partnership, hopefully, partnership working, you've got the idea is meant to be purposeful, not tokenistic. So you need to be clear about what question you're trying to answer, who you need to work with in order to answer it, in order to succeed. And then that informs who you're going to reach out to, your stakeholder mapping. And then just to have a little think then about, okay, what sort of knowledge do we need? What sort of resources do we need? Are we ready to have that conversation? And yeah, I guess the last point is, if you don't really feel ready, you don't feel confident, that's okay. PPI is a bit scary, but it's about putting yourself out there to be able to making new friends. So even if you're not entirely sure what you want to do or who you want to work with, even just beginning to go along to some group meetings, if there is a charity that you're interested in, or attending a forum, or going to a webinar like this, can just help just put yourself out there and get a little bit more comfortable with putting yourself out there and talking about your research. So I think that's it for me.